There are a lot of causes of knee pain, whether it's ligament issues or meniscus, arthritis. But I have a few exercises that might help, and we'll do them together. If anything causes you pain, don't do it. But let's start. We're going to do 4 range of motion exercises, 4 stretching exercises, and then 4 strengthening exercises. So our first range of motion, I want you to find an elevated surface so that your thigh is parallel to the floor. So a step or your kitchen chair. And then you're going to internally rotate. Just grab your calf and your tibia, and you're going to internally rotate it as you roll. Lunge forward and back. You can release in the back and twist and lunge forward and back. We do this 10 times, so this is 3. And of course, if it hurts, you're not going to do it. 4, 5. So we're working on range of motion. 6, 7, 8, 9, and 10. And now, whether one or both knees hurt, always do both sides. So we're going to twist and lunge forward. 1, 2, 3, 4. And I'm not twisting a lot, just a gentle pressure. And just inward, in towards your center. And I think that's 10. And then take your chair and sit down. You can use the floor or a bench. But if you straighten your legs, you might see that one doesn't straighten as much as the other. I don't have knee problems at the moment, so my knees probably straighten just fine. But I'm going to do a gentle pressure down. So if you do have one that's higher, let's just try and press it down. So we're going to do a gentle pressure. 10 and 9 and 8 and 7. And we're just trying to increase that range of motion. We're not trying to hurt the knee or the leg or ourselves. 4 and 3 and 2 and 1. Good, let's try this side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Now while we're sitting here, let's look at the kneecaps. I am not going to lift these legs, or these pant legs, to show you my kneecaps, because some things you just cannot unsee. But your kneecap, I want you to take 4 fingers from the top. I just want you to press it down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Same 4 fingers. I just want you to pull it forward, up towards your chest. 10, 9, and we're not forcing it, just a gentle pressure. Just 10 gentle pushes. And 3, and 2, and 1. And then one more direction is to the inside. We don't have to push the patella, the kneecap, to the outside, just a gentle pressure in. 2, 3, 4, 5. Once again, gentle, gentle. We're not trying to move it to the back of the leg or anything. And 1. And same thing on this side. We're going to press down. 10, 9, 8, 7, 6, 5. Good, and then pull the kneecap towards your chest gently. 2, 3, 4, 5, 6, 7, 8, 9, and 10, and then last movement is to the inside. So 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Perfect. Now, there's one more range of motion exercise that we're going to do on the floor. So I'm going to do one of the stretching exercises before we go down, and that's the calf stretch. So you can find a wall or a surface, lift your toe, and then press your hip forward to stretch that calf. If your foot doesn't want to do this, you can come back to your chair and just do a lunge and bend that, lunge back and stretch that calf. But let's hold this for about 30 seconds. So a calf stretch for about 30 seconds with me. Good. And just move side to side, work your calf stretch. Make sure it's working for you, not against you. And then we're going to switch and do 30 seconds on the other side. And you can move side to side with that stretch. Good. And then let's return to our range of motion. We're going to take a seat on the floor. You'll lay down on your back. And now it's just bending this knee into your chest. And you might not be able to get it this far, but gentle. 10, 9, increasing the range of motion that knee will bend, but not so that it hurts. And then do the same thing on the other side. You can have this foot flat on the floor, whatever makes you happy. But what we're trying to do is get more range of motion in this knee bend. So you might start here. If you can't bend it further than that, then just pull it in and try and bend that closer. And let's do 4 more. And 3. And 2, and 1. Good. Now while we're laying here on the floor, we're going to go ahead and straighten one leg. We're going to take the other leg across the body, extend that leg, and then put the toe on the floor. So you have a muscle right here. It's called your IT band, iliotibial band. And sometimes you've got a lot of muscles and ligaments attaching in your knee area that could be causing you problems. So if you'll take your leg across your body and just give this a nice little stretch, maybe loosening this relieves some pressure on your knee. Good, and we'll just hold this for 30 seconds. Of course, I don't have a timer running, but you can do it longer if it feels good, or shorter if it doesn't. And then you'll bend that knee and bring it back in, and we'll switch to the other side and extend the leg. And you can even play with this, move the leg up or down, and feel where that is stretching your IT band most effectively. And then just hold that for 30 seconds. Good, and then bring that back to center. Now there are a lot of ways to stretch your quadricep muscle, that's the front of your thigh. But you want to pull your heel into your hip. And you can stretch it here, you can do it standing. We do it in class in a little more vertical position. But 30 seconds, and what I'm doing is stretching the quadricep muscle, which attaches down at the knee. And this, this may be, you might not have this range of motion. You might just want to come up on your side and hold it here, push the knee back. Work with your body on what you need to do to feel a stretch in the front of your thigh, your quadricep muscle. And then just hold it for 30 seconds. Good, and release. Another muscle that attaches at the knee is your hamstring. And let's stretch one hamstring at a time. So bring this knee in to neutralize it. Lift your chest and then lean forward with your chest. You don't want to round your shoulders or send the top of your head down towards your knee. Just lift your chest and lean forward until you feel that stretch in your hamstring. And then hold it for 30 seconds. So to review, with our range of motion, let's go ahead and switch sides. For 30 seconds, just chest lifted, lean forward. So you're lunging and twisting your tibia in to get more range of motion in that knee and help that movement. Because when you walk, this tibia rotates. Then you're straightening your leg, range of motion that way, and bending your leg, range of motion that way. And then making sure that your patella, your kneecap, moves freely like it's supposed to. And release. Now, we stretched the IT band, the quadricep, the hamstring, and the calf, all the muscles that are attaching at the knee. We didn't stretch inner thigh, that's kind of hard to get to. But then we want to strengthen those muscles as well. So to strengthen your quadricep, you might just lift 2, 3, 4. Now you'll see my foot is flexed and I'm pressing out through my heel to move the emphasis of the muscle to the quadricep. Good, and then we'll try the other side, 10 and 9. If it makes you happier, you can put this foot flat on the floor. But what's important is to flex this foot and extend through your heel and feel the quadricep muscle working. And release, and then the last muscle strengthening exercise we're going to do, you'll put your hands down here by your hips, walk your heels in until they're touching your longest finger. You'll lift your hips, and you want to stop when you feel the weight of your body between your shoulder blades. You should be able to lift your head at any time, indicating there's no pressure on your neck or cervical spine. But if we simply lower and lift, squeezing our glutes at the top, we're going to use some hamstring muscles. So we're just strengthening the hamstring muscles by lifting the hips as we press down through the heels. And we'll do 6 and 5 and 4 and 3 and 2 and 1. Perfect. And then we lower the hips, bring one knee into the chest, grab behind the knee to your thigh, and use your body weight to help yourself up. So I'll repeat myself. There are a lot of reasons why a knee can experience, where you can experience pain in your knee. And I strongly encourage you to go to a doctor and find out the exact cause, and then learn what you should and shouldn't be doing. These exercises might help you. Don't do them if they hurt. And if you find that they're helping, do a few more after you turn off the video. And I hope this brings you some relief. Thank you.